Dementia is a devastating and progressive neurological syndrome that affects millions globally, with numbers growing rapidly due to increasing life expectancy. It encompasses a broad category of brain diseases that cause long-term and often gradual decreases in the ability to think and remember, eventually impairing daily functioning. While dementia is not a specific disease, it is commonly associated with Alzheimer's disease, vascular dementia, Lewy body dementia, and frontotemporal disorders, among others. To understand how dementia unfolds, it is essential to delve deeply into the widely accepted framework known as the Global Deterioration Scale, developed by Dr. Barry Reisberg. This scale outlines the 7 clinical stages of cognitive decline, from normal aging to severe dementia. In this in-depth educational video, we explore each of these 7 stages thoroughly, weaving in medical insights, caregiving strategies, and real-world examples to illuminate the nuanced progression of this condition. Stage 1 is known as the no cognitive decline stage. At this point, individuals function normally and exhibit no noticeable cognitive deficits. Brain scans, if performed, would show no abnormalities, and there are no symptoms suggestive of dementia. This stage serves as the baseline for all subsequent observations and is often overlooked because individuals are completely asymptomatic. For clinicians, this stage underscores the importance of preventive care, healthy lifestyle choices, and monitoring for risk factors such as hypertension, diabetes, or genetic predispositions. Though nothing seems amiss, subtle biochemical changes may already be underway in the brain. Understanding this stage provides an opportunity to introduce proactive measures, such as cognitive training exercises, proper nutrition, and physical activity, which have been shown to support brain health over time. Stage 2 is termed very mild cognitive decline, and it often mimics what is commonly referred to as normal age-related forgetfulness. Individuals might occasionally forget names or where they left everyday items like keys or glasses. These lapses are usually not alarming and do not interfere with work or social interactions. In a clinical setting, this stage can be particularly challenging to diagnose as dementia because memory lapses are not consistent or severe. From a caregiving perspective, this is the time to begin documenting changes and considering baseline cognitive assessments. Stage 3 is called mild cognitive decline and marks the beginning of noticeable impairments. Friends and family may begin to observe changes such as increased forgetfulness, difficulty concentrating, trouble organizing or planning tasks, and challenges with word finding. At this stage, the affected individual may start having trouble retaining information they've just read, or, finding the right words during conversations. During a medical evaluation, clinicians might detect these subtle deficits using neuropsychological tests. Importantly, individuals in this stage may begin to experience heightened anxiety or frustration as they become more aware that their cognitive abilities are declining. Stage 4, also known as moderate cognitive decline, is typically when early-stage dementia is diagnosed. In this stage, you see more pronounced memory loss and cognitive impairment. People may struggle to remember recent events, manage their personal finances, or even complete complex tasks like preparing meals or planning a trip. Folks in this stage might become socially withdrawn or confused, especially in unfamiliar environments. Clinicians at this point use standardized tools like the Mini Mental State Examination, often called the MMSE, to evaluate cognitive deficits. Caregivers begin to take on a more active role, helping with decision-making, providing transportation, and making sure medication is taken as prescribed. So, this stage is really pivotal in dementia care, as it often marks the transition from independent living to partial assistance. It's also a time when individuals might be more open to seeking help, making it critical to build a supportive care team. In stage 5, which is often called moderately severe cognitive decline, individuals require assistance with daily living. At this point, they may no longer remember important details such as their phone number, home address, or even the names of close family members. Orientation to time and place, really deteriorates significantly. Dressing, grooming, and personal hygiene begin to require supervision or even hands-on help. While basic conversational skills may still be intact, cognitive confusion can lead to disorientation and sometimes inappropriate responses. Emotional changes, including increased agitation, suspicion, or depression, are pretty common during this stage. From a medical standpoint, this stage necessitates a multidisciplinary care approach. Pharmacologic treatments like cholinesterase inhibitors may be used to slow symptom progression, though their efficacy varies. For caregivers, this is a phase filled with challenges: emotional, physical, and financial. Stage 6 is known as severe cognitive decline. This stage is characterized by extensive memory loss, personality changes, and significant assistance required for all activities of daily living. Individuals may forget the names of their spouse or children and might not recognize familiar surroundings. Delusions, repetitive behaviors, and sleep disturbances are frequent. Physical health may begin to deteriorate, and incontinence often emerges. Communication becomes extremely limited, with vocabulary reduced to only a few words or short phrases. Emotional regulation becomes increasingly difficult. At this point, care usually transitions to full-time, often involving professional caregivers or assisted living facilities. Medical professionals must monitor for secondary health complications, such as infections, malnutrition, or bed sores. Stage 7, the final stage, is called very severe cognitive decline. At this point, individuals lose the ability to communicate meaningfully. They are often nonverbal and may lose motor control, becoming bedridden. Swallowing difficulties pose a risk for aspiration pneumonia, which is, one of the leading causes of death in late-stage dementia. At this stage, total care is required, including feeding repositioning to prevent pressure ulcers and constant supervision. Emotional responsiveness is minimal, though some individuals may still respond to music or a familiar voice. The focus of care in this stage is really all about comfort and dignity. Pain management, soothing sensory environments, and emotional support for family members take precedence. Across all 7 stages of dementia, a common thread emerges: the need for empathy, preparation, and multidisciplinary support. Dementia not only affects the individual, but ripples through families and communities. It challenges our healthcare systems, our understanding of aging, and our capacity for compassion. Medical students, caregivers, and the general public must engage deeply with the realities of this condition to foster environments where those affected can live with respect and care. Whether you're witnessing early forgetfulness or supporting a loved one through their final days, knowledge is a powerful tool. Understanding the stages of dementia equips us to meet the challenges ahead with wisdom, sensitivity, and strength. This video has aimed to provide a thorough, science-based, and emotionally informed overview of dementia's progression. We hope it empowers you to recognize symptoms, plan for care, and advocate for better treatment and support. Thank you for joining us on this important journey of understanding. If you found this video helpful, don't forget to give it a thumbs up, share it with your friends and family, and most importantly, subscribe to the channel for more simple health tips that make a big difference. And while you're at it, tap the notification bell so you never miss out on our latest content. Thanks for watching, and we'll see you in the next video. Stay healthy and keep smiling.